I'm Dr. Strawford, and I'm the Medical Director at Skin Excellence Clinics here in the Southwest. I want to talk to you about radiosurgery, mole and skin lesion removal.
How does radiosurgery work?
So radiosurgery is a really interesting treatment that we've been doing for over 15 years now at Skin Excellence Clinics, and it's using radio frequency or radio wave energy to remove skin lesions such as a simple mole. Traditionally, I've been removing moles in the past by cutting them out with a scalpel and stitching up. That is an effective way of removing a mole, but there is it's more of an operative procedure with a downtime, a healing, and a greater risk of scarring. With radiosurgery, we effectively anesthetize a little injection of anesthetic into the area where the mole or skin lesion is to completely numb it. It's pain-free then. And we use the energy from the machine to destroy the cells of the skin lesion or mole. A little tiny loop touches the skin and emits the energy. And it literally vaporizes the cell into a gas. It destroys it. So we can selectively remove the cells or the lesion this way. It's akin to an airbrush. We're literally airbrushing that lesion away. And the importance is with this very specific, there are other ways of effectively burning away a mole, but they use electrocautery, and that causes a lot more damage around the area that you're trying to remove. So you end up with a bigger area of treatment and a greater risk of scarring. With radiosurgery, it's a precision tool. We can just remove the mole or the skin lesion and leave the skin beneath it and around much more intact. So there's a much quicker healing and a much lower risk of scarring. And we've literally removed many, many thousands of moles through radiosurgery at our clinics over the years with an extremely high satisfaction rate. I think one of the commonest reasons, things people say after the treatment is, if I'd have known it was that simple, I would have done it years ago.
Is there a risk of scarring?
There is a very, very small risk of scarring with radiosurgery, and it really depends on lots of factors. So we can remove the lesion very simply and very precisely with the radiosurgery. However, there is still a healing process. So at the end of treatment, it looks like a very superficial burn or scratch on the surface of the skin, which forms a scab, and there's a healing beneath the scab. And often I see that there will be scarring if people irritate or inflame that healing process, maybe by picking, scratching, knocking off the scab and prolonging the healing. Or if infection gets into the scab, again, through picking, scratching, and etc., then that can prolong the healing and affect it. So scarring is incredibly rare. We see it occasionally. If we see some scarring in the early stages following any of our treatments, then we can easily correct scarring involving a little injection of a tiny droplet of steroid into the scar material. We'll remodel the scar, or we'll use PRP or other treatments to remodel scars. So there are effective solutions to scarring, but we don't worry about that because the risk of scarring is very, very small with this treatment.
Can you get a mole removed on the NHS?
So I was a GP in the NHS for 30 years, and historically, yes, we used to remove moles, and that was, from my perspective, something that was a good service. But unfortunately, quite a number of years ago, the NHS deemed mole removal to be a cosmetic procedure which is not offered under the NHS, and and needed to be done privately. And there are situations where if a mole or a skin lesion is thought to be a cancer, that you would be referred to a specialist at hospital to have the lesion removed for that reason. We actually, if in certain circumstances, would biopsy a lesion before we remove it if we have any suspicion. But the main reason that we're doing it is because there isn't a facility in the NHS. So these are deemed as cosmetic procedures. However, I think many people find unsightly moles and skin lesions on the face, on the body, do affect how they feel about themselves. So the main reason for removing them is they want to look better, they want to feel better, and gain a confidence. I see that all the time. So that's the main reason for removing them. And I think it's sad that the NHS doesn't offer that as a solution, but certainly we can at Skin Excellence Clinics.
Why choose Skin Excellence Clinics for mole removal?
Well, why should you come to Skin Excellence Clinics for mole removal? As I said, we've over 15 years of experience with mole removal by radiosurgery. But not only that, our mole removal is done by experienced skin doctors. We understand skin and skin lesions, so we can diagnose if it looks like this is a skin cancer or another lesion that would not be best treated with radiosurgery and may need to be seen by a specialist dermatologist. So we know we can diagnose benign lesions. So number one is seeing a doctor to make an effective diagnosis of what we're dealing with. I see now lots of beauticians and even hairdressers, all sorts of people removing moles with little devices, plasma pens and different things they're getting off the internet. And I really have big concerns about that because A, they're not able to diagnose in the first place and manage, and the treatments themselves are more invasive, often will cause more scarring. So I see a lot of scarring and damage from those sort of treatments. So number one, coming to a medical clinic, CQC regulated facility, being assessed and treated by medically qualified doctors, and using the most effective treatment modality, which in this case is radiosurgery, as the best way of getting the outcome that you want. Yes, you can maybe shop around and get things cheap, but cheap doesn't always mean good and safe. So do your due diligence and check out, look at our reviews. We have extremely good, many reviews around radiosurgery and how good and effective it is.